If you notice up on the top right here of Sage, you've got all of the drop down kind of sub stages. And what this means is we have actually taken Sage and we've gone out and we've pulled all of the information from all of the 50 states. So we've looked at state boards of nursing, we've looked at all the professional organizations out there, and we've gathered all that information back into our database so that Sage is constantly being updated. And we actually have an AI automation that goes out and continues to pull that information and continues to bring it back. Within that, we've also built out some subsections. So you can check these out as well. So you can click on marketing. Say that you really want to build out a 30-day marketing plan on how you're going to grow your business. Well, you click on marketing, that's going to design these prompts in a way that is going to be both compliant from a Facebook marketing perspective. There's very strict regulations out there in the healthcare industry on what you can market and what you can say. And so Sage has actually been trained on all of those guidelines as well. So it's going to keep you compliant. Remember, when you put in your information, so say I come up here and I'm going to go to settings and I'm going to come down to my practice profile. All of this information that I put in is going to save to my profile. And what that means is when I come back to Sage here, I can say, what do I need in order to be able to inject Botox in my state? And what you're going to see is Sage actually knows that I'm a nurse practitioner in Arizona and that I've got full practice authority. Another thing that we built into this was the ability to both ask those clinical questions, but also get those forms and those handouts. So for example, I have a patient who came in and they were really overfilled on their lips and they want me to help them with this. Walk me through dissolving with hyaluronidase and talk me through dosing, kind of talk me through the safety aspects of this and the risks that I need to be aware of and what I need to tell the patient. And once this goes through, what you're going to find is that this is actually a really good baseline. And then you can actually go through and ask follow-up questions. The more information that you give, the better answers you're going to get. We actually added some really quick buttons down here. So we've got patient handout, we've got an SOP generator, we've got a protocol generator, and then we've got consents, a complete protocol that you can print and use for doing this. In addition, you can do a patient handout. That's one of my favorites. I think that just gives them something in their hand and you can do that quickly and on the fly right there in your clinic when you need to do it. We're really building this to be used at your table. Lastly, I'll point out here before we move on to the next section that down here on the bottom, we also put in an export. So you can actually export this right here as a PDF and you're ready to go.